A reliable system is one that achieves the goals it's supposed to achieve the vast majority of the time for the vast majority of patients. High reliability organisations and systems have got reliability levels up in the high 90s, whereas currently most healthcare processes have got levels of reliability in the kind of 80s. So it's hard to put numbers on it, but it's those sorts of levels that we're looking at. We were surprised how unreliable some of these basic systems were, and we studied 5 different systems and had a sort of overall level of reliability somewhere around 85%, with quite a lot of variation between participating organisations and between topics. We also were able to look across those as to what some of those causes of poor reliability were. And again, we're, I guess, struck by how similar the causes were across some of those themes, with issues to do with communication, acceptance of poor reliability as being normal and therefore staff not acting to do something about that, issues of poor standardisation, and a whole range of common things that we were able to identify. I mean, we've certainly seen several examples today of teams that have worked together to overcome exactly those sorts of problems, with standardising their clinical processes based on evidence, based on best practice, measuring how they're doing against those standards, and using teamwork, communication, whatever might be needed to try and achieve higher reliability levels in those areas. And I think we've certainly seen several examples of where teams have done just that with some very nice results. I mean, all the experiences would suggest that the first thing to do is actually to define what it is our system is supposed to be achieving and to standardise what the pathway should look like. I think unless we know what it is we're trying to achieve, it's very difficult to think about how you achieve that. So the first stage is standardising and defining your pathway, your process. We can then measure to say, well, are we managing to achieve that? And then if not, why not? And that's when the actions can move forwards, often using principles of quality improvement, of tracking progress over time, and all the accompanying things that we're hopefully getting more used to dealing with.